The NHS has dramatically improved over the last 100 years. Waiting times are shorter, patient satisfaction is higher, and cancer outcomes are better. However, service pressures are constantly higher, while the needs of patients are changing and new technologies and treatments continue to evolve. In this programme, we'll look at a range of intelligent solutions, from cloud communication and interoperability to cloud-based speech diagnostic systems and intelligent eyewear, to answer one question: can the NHS keep up?
Technology is making an impact in a huge number of areas within healthcare, but I think it's interesting to narrow the focus down a little bit and look at the NHS 5-year forward plan. That plan specifically looks to leverage the information that exists within the service today and actually aims to make the service paperless by 2020. But for me, it really does three different things, or it looks at three different areas. It looks at digitizing the patient experience, or how patients interact with the health service. It also looks to digitally enable the healthcare practitioners, so giving the people providing the care the best tools and the best information to be able to do that job. And then with regards to the information itself, it has to make sure that that information is correct, is accessible, but above all anything else, it's actually very, very secure.
The 5-year forward view for the NHS talks about operating at scale. So whether you're a PACS, a primary and acute combined service, or an MCP, which is a multidisciplinary community provider, these are services operating at scale across disciplines, and the patient record is going to be accessed by a whole range of different clinicians. So to operate at scale, lots of different clinicians from lots of different organisations are going to be accessing the patient record. You've got to make sure that record's available in real time so they can make high quality, safe clinical decisions on behalf of the patient. So when we talk about interoperability, we make sure that we are getting the data from wherever it lives, presenting it in a sensible and safe form to the clinician that's with the patient so they can do the best possible job.
We began working with smart glasses about 6 years ago. The idea was that some kind of wearable display might be able to help people who are sight impaired. And when we began, we originally had to make all our own gear because we were really experimenting with broad concepts around wearable displays. So as the field has started to evolve, we've been able to ride along with a lot of the people's really excellent developments in the area to establish first proof of principle of our concept and then potentially spin out some commercially available devices in the near future.
Speech recognition technology has recently been used to provide a cloud-based telephone diagnostic tool for patients with speech problems. It can help to provide mass screenings and allows patients to take the test, which could give an early diagnosis for mental ailments such as Parkinson's disease and dementia in the comfort of their home.
Using an automatic system to monitor health, I think, takes the onus off the NHS, the waiting list, the doctors, the clinicians, people that have to, the expensive resources that have to, or that are currently in place to do that today. By using an automatic system, it enables you to get more done simultaneously. You enable many people, the masses, because a lot of the visits, certainly initially, are all exploratory. So it's like, let's try to diagnose what a problem is. But being able to do that using technology, you can actually do a lot more of it, and it's not geographically limited.
Thank you for calling the AccuLab telehealth demo. Now take a breath, then say "ah" for at least 5 seconds.
So, for mass screening or anything like that where you want to try and track something, using automation generally would have a better result than a one-to-one meeting.
Digitising patient records is key to providing better and faster service across the NHS Trust and social care. As the NHS 5-year forward view looks to eradicate paper, digitisation is inevitable.
The digitization of the patient experience, I think, is probably the area that most of us are seeing technology having an impact, because it's the area that we all interact with when we use the health service.
Digitalisation refers to the changes of analogue information and convert it into digital. Think of digital transformation as the harmony of operations, technology and people all coming together.
From areas such as patient portals or self-service check-ins at doctors' surgeries, technology is starting to play a key role in engaging better with the patients. And I think this is something that's happening across all industries. Customers are becoming more and more demanding, are expecting better and more efficient service. Whether you're buying a new car, whether you're ordering your insurance for your house online or whatever, customers are becoming more and more demanding. And I think mobile and tablet usage to engage with those patients is a key way to deliver this.
For me, digital transformation is actually a fantastic opportunity to empower healthcare professionals to make better, more informed decisions faster at the patient's bedside. It's an opportunity for patients to have a better experience and care, either pre-treatment, during treatment, and post-treatment.
Digitization of records is paramount in the new millennium, and so is interoperability of computer systems. Records can be stored in a computer at a trust. However, this is no good, as this data cannot be accessed on the go. Real interoperability can ensure patient details are updated in real time and available to access
Well,
at
imagine
any
you
cloud-based
went
trust.
into your local high street store of a chain series of stores and ordered something from them, but they found it was out of stock. You might say, is it in stock in your other branch in the neighbouring town? And they might say to you, well, I'm afraid we don't know because our computers don't talk to each other. And you'd think that would be ridiculous, but in fact in the NHS that's exactly how it works. When you go and see your doctor, you probably see that they use a computer screen to look at your medical record, but they don't all use the same software, and the software that the doctor uses is their choice.
Interoperability is all about being able to look at a patient's record in an appropriate way whenever you need to. So in a direct care situation where clinicians with the patient, can they see what they need? The 5-year forward view for the NHS talks about operating at scale. So whether you're a PACS, a primary and acute combined service, or an MCP, which is a multidisciplinary community provider, these are services operating at scale across disciplines, and the patient record is going to be accessed by a whole range of different clinicians.
Augmented reality is a technology which can overlay digital graphic information on top of the user's real world. This smart eyewear can be used in healthcare scenarios, as well as help those who are partially blind regain some central vision.
You have two small projectors that are included in both branches of the glasses, and they are projecting one single image which is projected right in your field of view. The principle is to tackle augmented reality application, and therefore to overlay digital information on top of your real world.
We expect that there's some hundreds of thousands of people that we could potentially help with smart glasses. The concept of legal blindness is kind of sometimes a tricky one. Everyone thinks blindness means you have no sight at all. But about 90% of people who would classify themselves as blind still have some level of sight. And we currently are able to help about a third of those. So in the UK that leads to potentially 100,000, and in the world there are many millions.
Medical sector was one of the first to come up with ideas about using smart eyewear. And it was really interesting to see that their ideas could be quite fast implemented. There were some projects that were very basic but extremely efficient. They are using the glasses to mirror external displays so that the doctors, the nurses can stay focused on the patient, and by just seeing in the glasses the output of, for example, 3D scanners outputs.
Across hospitals and social care, the NHS needs to adapt to new scientific opportunities, but also face the challenges of modern healthcare, such as the growing demand for specialised medical services and the limited number of specialists available. Intelligent healthcare can only be achieved when these challenges are offset against the most recent innovation.
I think it's exciting times and also challenging times for the healthcare sector. Without a doubt, there's increased demands and expectations on healthcare services. There's tighter budgets, there's increasing costs, and there's also additional requirements around compliance and control. And so it is really important that the healthcare industry starts to innovate, and actually digital transformation is an essential part of moving forward in the face of these challenges.
There are a number of really great challenges in terms of trying to build a system for visual impairment. One we've been able to overcome really is the form factor and the aesthetic experience that goes along with these glasses. In our original work, we looked at helmet-mounted systems and laptops in a backpack and things like that, which are obviously too clumsy for somebody to use on a regular basis. But as computerization is miniaturized and a lot of these headsets become a lot smaller, we can start to consider a system which people would be able to use on a daily basis.
The NHS is a national organisation, and you can see an NHS doctor in a time of need wherever you are in the country. Usually, if I see a patient in that scenario, I have to rely on the patient accurately giving me their medical history. Occasionally they may bring with them bottles of prescription medicine so that I can verify that they are taking the drugs that they say with the doses that they're taking. And very occasionally, if I have any doubt about that, I might ring their home surgery and ask them to fax me some information. But clearly that takes a long time, it's very clunky, and sending faxes is not particularly confidential.
Cloud-based telecommunications technology can be used to provide incoming and outgoing communications. This technology can be used in healthcare for services such as telephone speech diagnostics. This reduces the need of a patient being physically examined by the doctor for speech-related ailments.
The reason for using something like a cloud-based system is the challenges today that clinicians or clinics that are measuring speech or anything like that have is that they have to have specialised equipment, which is generally a piece of expensive equipment. It's installed in maybe one clinic or one hospital or a few hospitals. It's usually a shared piece of equipment. The use and the access to it becomes very limited for patients. So I think the benefits really are that you can use something that's outside of the clinic to gather all of the important information. It can be at patients' leisure, so they don't have to travel into clinics or make appointments or anything like that. They can do it, have a schedule to do it in the comfort of their own home even, and then all of that information can then be later analysed. And when they do actually have to go to a clinic or a hospital, that way they've got the results, they've already done the analysis, and they make the most of their time. They may have a short appointment.
I will now say a sentence. Please repeat it back to me. Analyze my voice and send the results.
Analyze my voice and send the results.
So technology-based telehealth solutions have many advantages. The systems can provide access to a very large number of patients without any intervention, and they can then summarise that data and send that to the clinician or the GP as appropriate, and can be therefore used for things like mass screening of patients for any voice-related conditions.
If you're using, say, a telephone, which everybody has, they don't have to be located anywhere, they can be geographically spread. And if you want to do things like mass screening or anything like that, you're able to do so, and you don't have to rely on people getting into a clinic or the use of specialised equipment.
I've now received a recording from a patient via email, and we get a report which is quite detailed, but it has a summary at the top, just a few of the parameters which are often used by clinicians and speech and language therapists. These include things like the pitch of the voice, jitter, breathiness, creakiness, and other similar parameters which can give you information about the way the sounds are articulated. If there were any unusual values in these results, then they would appear as red bars on the graph, on the bar chart. As these are all green, they all look quite normal. Everything's pretty much the middle of the range. We can also, along with the email, we also get an attached audio file, which is a recording of the speech. And for the spoken sentence, we've got this file, which is, again, at first glance looks fine. There was nothing particularly noticeable or problematic in that, but if I were a clinician trying to diagnose somebody's problems, then I could look at that in more detail and assess it myself.
As well as automation and analytics, the digital revolution of information is vital for a 21st century healthcare. Digitisation of patient data not only helps eradicate paper in the NHS, which is one of the key points of the 5-year forward plan, but it also ensures the safety of patient information and data.
Digitally enabling healthcare professionals is one of the key areas where technology can play a very, very important part in healthcare. Think about the way that things used to work. Paper-based records were very easy to lose, very easy to damage, very easy to misfile. And actually trying to read some of the writing of the physicians that was on those records was very difficult and led to lots of mistakes. Digitizing those records instantly gives you a benefit in terms of speed and time savings. It's much, much quicker to store a digital record. It's much, much quicker to access those digital records. But beyond that, it also allows you to have multiple access from different locations at the same time on the same record.
I think digital transformation is something which every organisation should embrace. And of course, it means something different from one organisation to the other. But actually having this focus where we can look at technology, look at what's happening in other sectors, in our peers' businesses, and try to bring that together to actually leverage and harness and improve the way we operate.
Paper records are inherently insecure. Anybody could walk to the end of a patient's bed, pick up the paper record and start reading it. Instantly, medical records that are digitized provide an additional layer of security on top of that, by virtue of the fact that whoever wants to access that information has to log in using the appropriate security credentials to get access to that data in the first place. But beyond that, there are benefits around multiple access from multiple different locations, from multiple people to the same medical information at the same time. Think about an ambulance coming with a paramedic from a road traffic accident. As long as that paramedic can identify who the person that has been involved in the accident is, through mobile and tablet device technology, they can actually access their medical records en route to the A&E department, allowing them to identify if that patient is on any medication, if they've got any allergies, key things that can help them treat that patient en route to A&E. But beyond that, because they've now got the ability to update that medical record, they're actually able to potentially take videos, add audio commentary or text commentary on what's wrong with that patient. And then the A&E can actually get that information before the patient arrives, allowing them to very quickly pre-diagnose that patient.
Interoperability is a system where multiple computers running different operating systems can communicate with each other. This allows clinicians and doctors to access patient data wherever they are, regardless of their computer software. Furthermore, the records can be accessed on tablet and mobile devices, which are more suitable within the social health sector.
The Richmond General Practice Alliance was formed in 2014. One of the first pieces of work we were asked to do was to provide additional general practice appointments to try and take, at that time, some of the pressure off the local walk-in centres and accident and emergency departments. We were able to set something up fairly quickly using a paper-based system, but we found that enormously inefficient, perfectly possible but difficult. And that is what opened our eyes to the requirement for interoperability of GP systems. We have around 200,000 residents in our borough, and we wanted for the population of our borough to provide 4 hubs where patients could see a general practitioner or a nurse. irrespective of where they lived in the borough. They could go to any one of the hubs. We wanted the GP to be able to read from the medical record of that patient, and crucially also to be able to write back on the medical record so that the home GP knew what had happened in the hubs.
The process is very simple. The patient calls into the home practice, asks for an appointment that day, and the receptionist may say, "I'm sorry, we haven't got any appointments today, but I can book you into the hub." The patient is then booked into the hub, and when the patient arrives at the hub, they are then directed to see the hub doctor. Now, the beauty of this is once they get in there, the doctor is able to see their full clinical record.
The important thing with having the ability to have interoperable systems is that they are simply an extension of GP services as they stand.
One of the great advantages is that by using the system, when you're out doing a care home visit, what you would normally do is to take that particular patient's records either with you, or you can download them into the system using a laptop. The beauty of using the system is that if you're going to go into the care home and then you're asked to see another patient who you hadn't imagined that you were going to go and see, you can also see their patient records. The way we find out what clinicians need from an IT system is basically to sit down and talk to them. Try not to ask them how they'd like it to work, because most of the time they've got no idea, but try and find out the problems that they want to solve. So, even a casual over a coffee conversation, what's the bit that you like the most about your day? What's the hardest thing? What gets in the way of you managing a 10-minute consultation? And you work up a story. So you try and understand the problems that they need to solve, the challenges that they face with complicated patients, and how they need to see data.
Intelligent eyewear can provide an enhanced vision for partially blind people, but also could help surgeons and clinicians free their hands from manually handling data. This would enable them to fully concentrate on their patients.
Basically, augmented reality is overlaying digital image on top of your real world. If you consider the world of the medical, they need to have hands-free wearable device. So if you're just looking at what brings AR, overlaying digital information intuitively in a very simple way, and what can bring smart eyewear, freeing your hands, you have a perfect fit for what the medical area may require. They have very complex tasks to achieve, so what they want to do is to make an injection, and that might be a very tricky action. So by having the glasses, we will facilitate this in a very natural way. They will get the information in front of their eyes. They will be able to achieve in an easier way their tasks in a more efficient way, and they will act as they see the information, which is really a step forward compared to using a book or even a remote tablet.
Well, blind and partially sighted people have a number of key issues that they're trying to face in their life. The main ones are related to people's face recognition, either understanding who the person is in front of you, what expression they have, whether they're looking at you and engage in a conversation. That's a real critical one that many people lose, and it's obviously a big effect on your sense of well-being and your sense of social connection. So we really tried to work a lot on that. The other two issues people really face are ability to read, so resolving individual words or signage, and then finally the ability to navigate independently, so looking at obstacle avoidance, particularly in challenging scenarios, maybe low light or a cluttered environment, or potentially even up to something like a train station. So to augment someone's vision, so for the ability to see an expression, in some sense it's actually not that complicated. As a human, we've got this amazing sense of being able to see faces. You can see faces in clouds, there's a face in the moon, for instance. We're really tuned to pick up certain features. What we try to do is detect those features, such as an eye or the shape of the mouth or the shape of the hair, and highlight those almost to the extent of everything else. So dropping out all the background, all the kind of little details around the place, and just providing primarily just almost like a cartoon of someone's face. And what that does is it allows a person then to almost imagine all the other components to that. And for someone who's got, say, a small amount of blurry vision in the centre, what that allows us to do is kind of cut through that sort of mist and provide the landmarks for a person to be able to see.
The way forward in healthcare is when everyone works collaboratively. Innovation and new technologies are not always embraced by everyone. However, the ability to adapt to changing demands is what will keep our NHS alive.
Because of the complexities in the healthcare sector, it's really important that healthcare providers actually approach the opportunity to innovate and embrace digital transformation in a very structured and robust way.
I don't think the NHS can afford not to adopt technology. That the world has been adopting technology and replacing human-based activities forever. It's just a matter of time before the NHS realise that they have to do more with less.
The ability for a doctor to make sensible decisions relies on the information that they have. If they have access to the medical record, they can make safer, better decisions in concert with the patient.
Once we've solved things like, started to solve things like navigation, we can then look at text as a whole new question. So actually as a research group, there's never end to what we actually want to be able to do. And obviously, like everyone in this area, we want to be able to ultimately make something which is highly applicable to a huge number of people and almost indistinguishable from regular glasses. So we're making the first major step in that area, but we've still got a long way to go.